So this next panel is on reclaiming the patient-doctor relationship through direct care in 2023 and beyond. Our first speaker is Dr. Roger Mochagamba. He's the father of 3 from San Antonio and decided to adopt a revolutionary idea of direct primary care or direct contracting that made medical care direct, accessible, transparent, and affordable to everyone. He's worked in family practice, occupational medicine, and urgent care since 1994. Please welcome Dr. Mochagamba.
Thank you. It's great to be here, and you did a good job on my last name. People usually just call me Dr. Roger, and that's fine. So I am very honored to be asked to speak today to this organization because of everything that the AAPS stands for. So I've been thinking about what I'm talking about today, and I think I've been asked to present a little bit different than we had presentations yesterday, whereas yesterday we had some great speakers take a deep dive into some really important topics. Today, in a way, the doctor-patient relationship is extremely important as well. But instead of taking a really deep dive into that, I think I've been asked to share a little bit about one of the ways that we can help improve that, the way it's turn around the deterioration in that. And then for me to show some examples of that, and that's what I prepared. So a little bit about me. I started a direct primary care practice in San Antonio 6 years ago. As far as I know, it was the first one in San Antonio. I'm also kind of an entrepreneur. In 2004, I started or helped start a company called Teladoc, the first real big telemedicine company. Did that for 9 years as the president of that physician association. And then in 2016, I helped start another nationwide telemedicine company called DialCare. And when I came across the direct primary care model, it was so amazing. It was so refreshing to see that we could practice medicine that way. So I'm like, this is great. So I got started with that 6 years ago in San Antonio. So over the years, from when we were children, the doctor-patient relationship has gone from personalized care in the past with an emphasis on human connection to now with the rise of bureaucracies, more paperwork, limited face time with doctors, and on and on. It's become more transactional. So take a look at this picture and just let it sink in for a minute. The picture of the doctor at the bedside kind of brings back a feeling, for me at least, of this human interaction that I thought I was going to have by becoming a doctor. Went through the training and got into practice, and didn't take long. I realized that it wasn't really that way. The other picture with everybody having a number on their back, in a way, has, at least at parts of my career, I felt like patients were just numbers and I needed to just get through the day, and I didn't like that. And then along comes electronic medical records and just exacerbated that problem. But at second glance, when I looked at this picture more, I started to realize that it's not just patients that have turned into numbers, but I think in these days a lot of us will understand that doctors have turned into numbers too for insurance companies. We're kind of their minions now. So this is Jay Kempton, and this is a picture of a talk that he gave at the annual meeting of the Free Market Medical Association this last year. He was a co-founder of that, and I put that up here because he gave this amazing talk about how he wanted to go with his daughter to get a procedure done and just pay cash for it. the office kind of freaked out. They thought he was a troublemaker because he just wanted to pay cash, and they had to get other people. It's an amazing story of how healthcare has become all about the insurance card. So if you want to be amazed and entertained, go listen to that. It's on YouTube. Now, on the way up here, I was reading a post on Facebook by a doctor that was talking about how she was struggling to get pre-authorization done for a lumbar MRI for her patient. She spent like an hour on the phone talking to this person and that person and the next person. And so then she was saying how they were requiring now her tax ID number. She's like, why? She couldn't figure that out. They wouldn't really tell her. But anyway, so AI is becoming a big thing these days, and of course it's getting involved in healthcare. That's just something that's going to push us further, increase the gap between doctors and patients. So now Humana is going to be requiring doctors tax ID number for prior authorizations. I don't want to focus too much on the negative. So let's talk about direct primary care and how that can improve the doctor-patient relationship. It's a healthcare model focused on just the doctor and the patient, no middleman, no insurance. What can direct primary care do? It increases more face time between the doctor and the patient. In our clinic with new patients, we spend an hour, and with follow-up visits, we schedule them at half an hour. Virtual visits are free. Folks can text us with a HIPAA-compliant secure app. Folks get in the same day or next day. We have personalized care plans. The way the direct primary care works is folks pay a membership, a low monthly fee to the clinic. In my clinic in San Antonio, it's $89 a month. So is that affordable? It's affordable, right? I tell people all the time that health care is affordable. It's health insurance that's not affordable. Health insurance is expensive. I tell people all the time that health care that you hear in the media, when they're talking about that, they're really talking about health insurance. But what I do is health care. That QR code that's on this slide gives a little bit more. It takes you to a video I did talking about care journeys, and care journeys is something that we're doing in my practice where we're taking a chronic condition, we're sitting down with the patient, identifying what this chronic condition is, and then we will talk to them about where they need to be, what the goal for their A1C is, or their BMI, or their blood pressure, or whatever. And then we will set a plan with them. This is where we want to be in 3 months, and this is what it's going to take to get there, whether it's medication. Medication's the typical approach, but we all know that lifestyle is really, really important in managing chronic conditions. But in the traditional model, that's not something that doctors really focus on. So with a care journey, we're going to have an app. We have an app that allows a person to be accountable to their lifestyle changes that we put in place at this initial visit. So that QR code talks about that more. And so then at the end of the 3 months, at the end of this care journey, we have another follow-up visit and we assess their progress and see where they've been. So the point is to help people be accountable daily with their lifestyle changes. That's something that we can do when we have time to sit down and talk with our patients, and we really take the time to wrap our arms around their care and individualize it. Through DPC, direct primary care, we can better understand our patients because we have time to sit and take a history from them. We build trust and continuity of care. Now, here's an example. It was a Friday afternoon, and I was in clinic, and I get a call from Lori, who's one of my patients, and she said that she and her husband were driving up to North Texas to go to a weekend retreat. And so Lori was driving, her husband's a passenger, and he was on a conference call during the drive, and he fell asleep. So she was like, hey, what's going on with you, you know? Okay, and so he says, well, I've been having a little chest pain. So she diverted over into the nearest ER. They went in there, and while she was in the emergency room, she called me. And I said, well, let me talk to the doctor. And I talked to the doctor, and he said, yeah, he ruled out for an MI. And I said, well, it sounds like this is probably what he needs. And that doctor agreed. And so then I got back on the phone with Lori, and she said, you know what, we're going to cancel our weekend. I'm going to come straight to the clinic. And I said, well, you can do that, but wait, before you do, I made a call to the cardiologist, and I told him what was going on. And I said, he probably needs a Holter monitor. Yeah, he probably does. So what's his name? I'll have the staff wait. Okay, so I told Lori, just go straight to the cardiologist. So how many steps did we just miss? How much time did we save? So that's what we can do when we know our patients, right? So some of the challenges that we have in expanding direct primary care is the resistance from the status quo and traditional setups. Patients don't know about the model. They're worried about higher level of care. There's insurance brokers and ways around that. We have to educate our patients. And what we can do as a community is education, collaborative models, and legislative support. Some of the things that I've done is I've started the Free Market Medical Association chapter in San Antonio. This is a picture from one of our meetings, and I'm so excited because in the last couple of meetings we've had the whole healthcare continuum there represented as direct pay. Primary care, secondary care, tertiary care, employers, and brokers that want to work for the best interest of their clients. I've testified in Austin last year to a special committee on healthcare, and I told them passionately that we don't need insurance for primary care, and we don't because I'm providing affordable access to healthcare for people without insurance for primary care. I wanted to share this too because I market a lot to employers in my practice. This is a paragraph from a quarterly report, the first quarterly report for an employer in the area, San Antonio, where we put they wanted an on-site clinic, so we put a doctor there. In the first 3 months of service, the company paid Direct Med Clinic $56,000, which included pass-through cost for direct care, which would have cost in the traditional system $69,221 for patient encounters, labs, imaging, and procedures. This is a direct cost savings of $13,221. That's in 1 quarter for this employer. In addition to the above direct savings, 2 emergency department visits, 6 urgent care visits, and 2 specialist visits were avoided. A total of 260 avoided work time absences were realized in the first quarter. The indirect cost savings of this employer was $34,000. So that is about an 84% ROI. We can do that with direct contracting. Okay, so understanding the value of the direct doctor-patient relationship is huge. So I am so happy to be here and part of this panel. I'm done and look forward to taking your questions later.